Slide 1. Electrophysiology of the Heart is a series of slide tape programs developed and presented by the American Physiological Society. This is Cardiac Cellular Electrophysiology. Content expert, Dr. Harry Fozzard. 2. This program presents a discussion of the cardiac ionic events and structural properties responsible for the cardiac action potential, its generation and transmission. Your understanding of the concepts presented in basic membrane electrophysiology is prerequisite to successful completion of the program. 3. Questions and answers are provided throughout this program to allow you to assess your readiness for the program, your progress during development of the concepts, and finally, your overall comprehension of the material presented. After a question appears, you must stop the tape while you formulate your answer. Many of these answers require you to make rough sketches or simple drawings. After an answer is presented, you must stop the tape to assess your response. Of course, you should also stop the tape whenever you want to study the visual material. The prerequisite test begins on the next slide. 4. In this diagram, differing concentrations of a salt solution are separated by a semi-permeable membrane through which one ion of the salt diffuses with much greater ease than the other. At equilibrium, a potential exists across the membrane. This potential can be calculated by using the Nernst equation. Write the Nernst equation and identify each term in the equation. Five. This is the general form of the Nernst equation. Six. The basis of the resting potential, V sub m, in nerve cells is the transmembrane concentration difference of what ion? In the squid giant nerve studied in the previous slide tape, what is the approximate value of the resting potential? 7. The basis of the resting potential is the transmembrane concentration difference of the potassium ion. In the squid giant nerve, this is approximately minus 65 millivolts. 8. In the previous slide tape, Basic Membrane Physiology, it was shown that a depolarizing voltage transiently opens the sodium gates. The time course of inactivation, closing of the sodium gates, is described by the inactivation constant 1 minus h in the Hodgkin-Huxley formulation. On this graph, state whether the voltage-dependent sodium gates are closed or open at 0, 1, 2, and 10 milliseconds. 9. The voltage-dependent sodium gates are open only at 1 millisecond. 10. In this program, we will discuss the difference between nerve and cardiac action potentials, 5 phases of the cardiac action potential and ionic events responsible for each phase, special structural properties of heart muscle and factors influencing conduction velocity, automaticity, and special characteristics of the SA and AV nodes and the effects of neurotransmitters. 11. As your first objective, you should be able to state the 2 main differences between nerve and cardiac action potentials and also state the important consequences of each of the differences. 12. In the previous slide tape, Basic Membrane Physiology, the action potential of the squid giant nerve was discussed. There are 2 major differences between the action potential of cardiac cells and nerve cells: the duration of the action potential and the presence of automaticity. 13. The first difference between nerve and cardiac cells is the length of time taken by the action potential. The depolarization phase is similar in both nerve and cardiac cells. However, the cardiac cell does not repolarize rapidly. It remains depolarized for 200 to 400 milliseconds, as compared to an average of 1 to 2 milliseconds for a nerve cell. 14. Because depolarization activates contraction, the prolonged cardiac cell depolarization has important consequences for cardiac function. 15. The depolarized cardiac cell is refractory to another stimulus until after it has repolarized. This long refractory period prevents a second contraction from occurring too early and ensures the necessary periods of relaxation between contractions, allowing the heart to refill with blood. In this example, the first and third stimuli found the cell excitable. They produced action potentials and the associated contractions. The second and fourth stimuli occurred before the cell had repolarized, so it was inexcitable. 16. Longer action potentials produce larger contractions. This effect is maximal with action potentials of greater than 100 milliseconds. So, normally, contraction is maximally activated. Clearly, factors that change the shape of the action potential may markedly modify contraction. 17. The second major difference between nerve and cardiac cells is automaticity. After repolarization, some cardiac cells do not maintain a steady resting potential, but instead depolarize themselves gradually to their own threshold. In this way, they can initiate their own action potentials without influence of other nerve or muscle cells. Even individual cardiac cells in tissue culture can display automaticity. 18. Automaticity, the ability of the muscle cells to generate their own action potentials without stimulation from the nervous system, is an essential characteristic of the heart. It permits the heart to beat steadily and regularly in spite of large changes in nerve activity. A dramatic example of this is seen in cardiac transplants, where the transplanted heart can beat immediately and need not wait for ingrowth of nerves from the recipient. 19. Sketch this cardiac action potential and label the two main features that distinguish it from the nerve action potential. State the important consequences of each of these differences. 20. The cardiac action potential is much longer than a nerve action potential and may be initiated automatically. As a consequence of the long action potential, the cell is refractory for a period of time. This prevents a premature initiation of a second action potential and allows the muscle cell to relax. Automaticity permits the heart to determine its own beating rate without dependence on the nervous system. 21. As your second objective, you should be able to 1. Sketch a cardiac action potential, label its 5 phases, and identify the ionic conductances responsible for them. And 2. State 2 causes for a change in shape of the cardiac action potential. 22. Using the Purkinje fiber, a specialized cardiac cell, as a model for discussion of the ionic basis of the cardiac action potential, we can identify 5 phases. They are numbered sequentially: upstroke, phase 0, partial repolarization, phase 1, plateau, phase 2, rapid repolarization, phase 3, and pacemaker depolarization, phase 4. 23. Depolarization, phase 0, is at a rate of 100 to 500 volts per second, much like nerve. In atrial and ventricular muscle, depolarization is due to an increase in sodium conductance, GNA, and entry of sodium into the cell down its electrochemical gradient. Recall that the increase in the sodium conductance represents the opening of voltage-dependent sodium gates. In heart cells, as in nerve cells, the depolarizing inward current of the action potential is transient. On depolarization, the current will turn on and then will turn off. 24. Initial repolarization, phase 1, is due to an inactivation of the transient sodium current which is caused by a fall in sodium conductance. In some cells, negatively charged chloride ions enter the cell, favoring repolarization. 25. The plateau, phase 2, is a prolonged period during which the inward sodium and calcium currents and outward potassium currents are almost perfectly balanced. During phase 2, sodium current is low due to the inactivation of the sodium conductance. Calcium ion conductance transiently increases, allowing entry of calcium into the cell. The calcium current may play a role in causing contraction to begin. Since the membrane is somewhat permeable to potassium, potassium moves out of the cell, balancing the inward movement of sodium and calcium. 26. Rapid repolarization, phase 3, is due to a gradual rise in potassium conductance similar to the increase in potassium conductance seen in nerve, but smaller and much slower. As potassium conductance rises and calcium conductance falls, the outward movement of potassium exceeds the inward movement of calcium and sodium, and repolarization occurs. 27. Pacemaker depolarization, phase 4, results from a small fall in potassium conductance in the presence of a small inward current, probably carried by sodium ions. This process is responsible for automaticity and will be examined in greater detail later in this discussion. 28. The shape of the action potential differs from one part of the heart to another. You have seen that it is dependent on complex sequential changes in conductances to sodium, chloride, calcium, and potassium ions. The interaction of these ion movements differs from one part of the heart to another. 29. Also, large changes in the shape of the action potential can be caused by small changes in concentrations of electrolytes or hormones. In this example, an increase in external potassium concentration increases potassium conductance at all potentials in some as yet unknown way, and thereby shortens the action potential. This sensitivity of the action potential is due to the fact that the ionic conductances in the heart are lower than those in nerve, so small changes easily unbalance the net membrane currents. This is especially true during the plateau phase, where the total conductance is lowest. 30. Sketch a Purkinje fiber action potential. Label the 5 phases and indicate the ionic conductance changes responsible for each phase. State 2 causes for differences in shape of the cardiac action potential. 31. These are the phases and conductance changes during a Purkinje fiber action potential. 2 causes for differences in the shape of cardiac action potentials are: 1. Conductances are not exactly the same in all parts of the heart, and 2. Small changes in electrolytes or hormones can make large changes because ionic conductances are relatively small. 32. As your third objective, you should be able to describe 1. The structural properties of heart muscle that allow cell-to-cell transmission of the action potential, and 2. The factors that influence the velocity of conduction of the action potential. 33. All atrial muscle cells are electrically continuous, and all ventricular muscle cells are electrically continuous. So these 2 muscle groups can have coordinated contractions. The atria and ventricles are separated by the fibrous skeleton of the heart, to which the valve leaflets are attached. The action potentials of the atria are conducted to the ventricles at only one point, the atrioventricular, or AV node, and its extension, the bundle of His. 34. The electrical connections between cells is of great importance in proper cardiac function. The cells are about 100 to 150 microns in length and about 10 microns in diameter. They are connected to each other at the intercalated discs through special membrane regions called gap junctions. These connections allow movement of small ions and thus current between cells. 35. If one part of a cell is depolarized to threshold for an action potential and positive charges begin to flow into the cell, these charges can spread to adjacent parts of the cell, bringing them to threshold for an action potential. This is the same cable property that we examined in the nerve. 36. Since the cells are electrically connected through the gap junctions, charges can also flow to adjacent cells, bringing them to threshold for the action potential. In this way, the wave of depolarization to threshold that precedes the action potential is conducted throughout the heart muscle. 37. The conduction velocity of the action potential is determined largely by two factors. First, the intensity of the inward current, and second, by the resistance to current flow to adjacent unexcited cells. Synchronization of excitation and contraction of the cells of the atria or ventricles depends on the velocity of conduction of the action potential. 38. The intensity of the inward current is a key factor in determining the conduction speed of the action potential. The determinants of the intensity of the inward current are the resting potential prior to stimulation and the electrochemical gradient across the membrane. The inward current must not only supply the charges necessary to depolarize the membrane of that region for its action potential, but also must provide some extra charges to flow along the cell through the cytoplasm and gap junctions to depolarize the adjacent membrane. 39. Remember that the inward current, I sub I, is determined by the conductance, G sub I, times the ionic equilibrium potential, E sub I, minus the membrane potential, V sub M. Therefore, the intensity of the current is directly proportional to the membrane conductance of the ion carrying the current. 40. The intensity of the inward sodium current is determined by the number of sodium channels that can be opened on depolarization. As you may recall from study of the nerve membrane, the gates that turn off the sodium channel will close as the membrane is depolarized. For example, if the resting potential is minus 70 millivolts, about half of the gates that would be open at minus 90 millivolts are already closed. Therefore, when the action potential occurs, only half as many sodium channels are available, and the inward current is only half as large. 41. The intensity of the inward sodium current is also determined by the electrochemical gradient across the membrane. This is the driving force causing the ions to move. As an example, the chemical gradient for sodium can be altered by changing the sodium concentration inside the cell. If the sodium concentration outside remains the same, then ENA is altered in an amount you can predict from the Nernst equation. 42. The second factor influencing the speed of conduction of the action potential is the resistance to current flow to adjacent membranes. The resistance is dependent on the cell diameter and on the number of gap junctions. 43. Resistance is greater in cells of smaller diameter. If the cross-sectional area of the current path is small, the resistance is high and less current flows. This is analogous to the resistance of a wire, which depends on its diameter. Note that the ability to conduct current in the cell also depends on the concentration of freely movable ions present, but this does not vary much from cell to cell. 44. Resistance is also higher if there are few gap junctions. 45. As in any circuit, the current loop must be completed. Inflow of current during the action potential renders the inside of the membrane positive, but at the same time it makes the outside relatively negative. Current will flow in the surrounding extracellular space into the depolarized region. This is the local circuit current. This current establishes an electrical field which may be detected and recorded on the surface of the body. The record of variations in this field is the electrocardiogram and will be discussed in detail in the later slide tapes in this series. 46. Briefly describe the structural properties of heart muscle that allow cell-to-cell transmission of the action potential. The factors that influence the velocity of conduction of the action potential are the intensity of inward current and the resistance to current flow. Name two determinants of each of these factors. 47. Cell-to-cell transmission of the action potential is possible because all atrial cells are electrically continuous and all ventricular cells are electrically continuous. Gap junctions between cells allow movement of small ions, current, between cells. Conduction velocity is influenced by the intensity of the inward current, which is determined by the electrochemical gradient across the membrane and by the resting potential prior to activation. Conduction velocity is also influenced by the resistance to current flow, which is determined by cell diameter and the number of gap junctions between cells. 48. Your fourth objective is to be able to 1. State the major factor responsible for the process of automaticity and describe the sequence of events involved, and 2. Describe the effect of sympathetic and parasympathetic stimulation on the rate of firing of the pacemaker cells. 49. Automaticity is the ability to depolarize spontaneously to threshold for the action potential. Voltage clamp studies have shown that this is due to a gradual fall in potassium conductance. As the potassium conductance falls, the outward potassium current falls and no longer completely offsets the small inward sodium current. The membrane current gradually becomes inward, depolarizing the membrane. So, as the potassium conductance falls, the membrane potential drifts away from the resting potential. 50. As the membrane potential reaches threshold, the inward current channels open, producing the action potential. Note that under normal conditions, not all cardiac cells are automatic. However, under abnormal conditions, all heart cells, and nerve cells as well, can show automaticity. 51. The rate of firing of a pacemaker cell is determined by the extent to which the potassium channels are initially open and by the rate at which they shut. This sensitive control permits the nervous system to influence heart rate. 52. Acetylcholine, released by stimulation of the vagus nerve of the parasympathetic system, increases the number of open potassium channels, increasing potassium conductance at all membrane potentials. Consequently, it decreases the pacemaker rate, since a longer time is required to decrease potassium conductance to the point where the action potential threshold is reached. 53. Norepinephrine, released by sympathetic nerve fibers, seems to decrease the number of open potassium channels by increasing the rate at which the channels shut. Consequently, it increases the pacemaker rate by allowing the fiber to reach threshold sooner. 54. Respond to these questions with brief descriptive phrases. 55. Compare your responses to these. 56. As your last objective, you should be able to 1. List the 3 areas of the heart normally capable of pacemaker activity. 2. List 4 electrical characteristics of the SA and AV nodes that distinguish them from atrial and ventricular muscle. And 3. State the effect of epinephrine and norepinephrine on the SA and AV nodes. 57. Normally, 3 regions of the heart are automatic: the sinoatrial node, the lower part of the atrioventricular node, and the Purkinje fibers. The sinoatrial node is the normal cardiac pacemaker because it has the highest intrinsic rate, but other regions are available to drive the heart at a slower rate if required. The atrioventricular node electrically connects the atria to the ventricles and conducts slowly to permit proper sequencing of contraction. 58. The first electrical characteristic of the cells of the SA and AV nodes that distinguishes them from atrial and ventricular muscle is that they have a less negative resting potential. Recall that resting muscle cells have a potential of -75 to -90 millivolts. SA node cells may have a maximal negative potential of only -65 millivolts, and AV node cells are usually -70 to -75 millivolts. It is not known whether this reflects a lower intracellular concentration of potassium ions or a lower potassium conductance relative to other ions. 59. The second electrical characteristic of these cells is their slow depolarization rate. The action potential upstroke is about 10 volts per second, more than 10 times slower than that of atrial or ventricular muscle. 60. The slow upstroke is a reflection of the third electrical characteristic of the SA and AV nodes: their dependence on inward current channels that open and shut slowly, slow channels. The upstroke is so slow, it is hard to believe that the same inward current channels found in other heart cells could play a role. 61. When the SA and AV nodes are exposed to agents that block the sodium channels of atrial and ventricular muscle, no change occurs in their action potentials. Therefore, it seems likely that these cells do not have a normal number of sodium channels of the sort found elsewhere in heart muscle and in nerve. 62. However, when the SA and AV nodes are exposed to agents that block the slow channels, they have slower conduction or lose their action potentials altogether. 63. Since the action potential of the AV and SA node cells depends on current carried through the slow channels, the next step is to identify the carriers of this current. By changing outside concentrations of calcium and sodium ions, one can show that the depolarization rate and the overshoot are sensitive to both, suggesting that both types of ions can go through the slow channel. For convenience, this is often called the calcium channel, even though both sodium and calcium ions can pass through it. 64. An important effect of the dependence on slow or calcium channels is seen through the action of epinephrine and norepinephrine. These hormones dramatically increase the number of calcium channels. In the SA node, this favors a faster pacemaker rate, and in the AV node favors an increased conduction velocity. How the hormones change the number of channels is an intriguing but unanswered question. 65. The fourth electrical characteristic of the SA and AV nodes is the slow conduction velocity of the action potential in these tissues. In the AV node, conduction may be only a few centimeters per second, 50 times slower than conduction in nerve or in Purkinje fibers. Slower conduction velocity would be expected with the reduced inward current intensity in these tissues, consistent with their slow depolarization rate. In addition, the cells of the AV node are smaller and may have fewer gap junctions, both of which increase resistance and therefore favor slower conduction. 66. Respond to these questions with brief descriptive phrases. 67. Your responses should be similar to these. 68. In summary, we have identified the main characteristics of the cardiac action potential. We discussed the 5 phases of the cardiac action potential and the changes in ionic conductances responsible for them. Contraction of the heart was related to duration of the action potential, and automaticity was related to control of the heart rate. 69. The special structural properties of cardiac cells and their function were identified. We discussed the determinants of conduction velocity, including inward current, resistance in the cytoplasm and cell junctions, and return of current in the extracellular space. 70. Automaticity, the factors influencing automaticity, and areas of pacemaker activity in the heart were discussed. The action potentials of these areas were compared to those of other portions of the heart. The post-test begins on the next slide. 71. Complete these statements and respond briefly to question 2. 72. Compare your responses to these. 73. Phase 0 is due to a large increase in membrane conductance to what ion? Phase 2 is a balance between inward current and outward current. What ions carry inward current? What ion carries outward current? Phase 3 results from the gradual rise in conductance to what ion? 74. Phase 0 is due to a large increase in sodium conductance. Phase 2 is a balance between inward current carried by sodium and calcium ions. Phase 3 results from a gradual rise in potassium conductance. 75. Make a sketch of these cardiac cells and show the flow of current during depolarization and propagation of the threshold potential for an action potential. Name the factors influencing conduction velocity and 2 determinants of each factor. 76. The 2 major factors influencing conduction velocity are the intensity of inward current and the resistance to current flow in the cytoplasm and between cells. The determinants of the inward current are the electrochemical gradient across the membrane and the resting potential prior to stimulation. The determinants of the resistance to flow are the cell diameter, or cross-sectional area, and the number of gap junctions. 77. Complete these descriptions of the automatic tissues of the heart. 78. Compare your responses to these. 79. These references are provided as suggestions for further study. 80. This completes the presentation of cardiac cellular electrophysiology. The series Electrophysiology of the Heart continues with the programs Electrical Anatomy of the Heart, Disorders of Cardiac Rhythm, Electrocardiography, Fundamental Theory, and Electrocardiography, Applied Theory. This program was produced by the Education Office of the American Physiological Society.